Hi, everyone. I'm Dr. Janina Jeff, Staff Bioinformatics Scientist here at Illumina, and today I have the privilege of speaking with Lisa Alderson. Hi, Lisa.
There.
How are you?
I'm doing great. How are you?
Good. So if you don't mind, give us a little introduction into who you are.
Sure. So I'm Lisa Alderson, the founder of Genome Medical, and I have been a serial entrepreneur working over the last 2 decades to make precision medicine much more accessible, equitable, and affordable.
So can you give us a little background? What does Genome Medical do?
We are the leading telehealth provider enabling genomics-based care to patients all over the country. And we do that in partnership with health systems. So we bring in specialists along with clinical decision support tools to bridge many of the care gaps that are present today in genomics.
Wow, that's a really big goal. You guys are doing a lot of work. Tell me a little bit about how you started Genome Medical.
Well, so as a longtime entrepreneur, I actually helped build a couple of the leading molecular diagnostic testing labs, so Genomic Health and Invitae. And through that process, it became clear to me that there's a tremendous amount of advancement in the science and capital coming into innovation, and we're building better assays for prevention, diagnosis, and treatment. But a lot of the promise of genomics will go unrealized unless we can actually get it into the hands of providers to improve and impact patient care. So I started Genome Medical because I saw that as the leading barrier to advancing human health using genomics.
Wow, that's amazing. So I have to ask, how, being a woman in science and being a co-founder and at one point a CEO, what is it like being in the C-suite? Are there any challenges, any advice you can give some aspiring women in science and entrepreneurs who want to follow in your footsteps?
Well, first of all, we have big challenges across many different disciplines, healthcare, environmental sciences, et cetera. And so I want to encourage, especially new women coming into the field, just to aspire to really embrace the sciences and technology and medicine and really drive advancements into clinical care and just be a part of the impact we can have.
Yeah, and we're here. We're here. Okay, so we are at Illumina's Genomic Forum. Tell me, what are some of the key takeaways that you've experienced here at the meeting?
Well, I thought just from the opening remarks from Francis, hugely inspirational. It is so clear how genomics is impacting healthcare today in really so many different areas of medicine, including at Genome Medical. We really work in oncology. Precision oncology is a big movement towards advancing how we treat patients throughout the whole care continuum, from prevention to multi-cancer early detection to, really utilizing germline genetics and somatic tumor profiling to better understand, the causes of disease and ultimately select the right treatment choices. There's companion diagnostics that can help with that. And then ongoing molecular monitoring at a minimal residual disease level to determine persistence and recurrence. And so much happening in oncology, but also cardiology, neurology, pediatrics, newborn screening. It really touches so many different areas of medicine. And so the big themes from the conference for me have really been around, it is the genomics era. It is now. One of my big messages I've been communicating, including in one of the panels that I led and discussion, is it really is now. It needs to come into clinical care today. It is actually part of standard of care. We have many places where genomics is now medically indicated. It has reimbursement coverage. There's very clear clinical utility. And when appropriately applied, it can actually drive cost savings in clinical care. And so we need to be working to advance genomics into the care setting today. And it continues to have barriers and challenges, in part because the field has moved so quickly that it is really quite difficult as a clinician to know who needs it, what tests to order, and how to interpret the results and utilize that for ongoing clinical care.
Yeah. Well, when you were talking about what you guys work on, I was thinking about all these different things that we need to be made possible in order to get this to work well. What are some of the challenges? You mentioned kind of the physician education and that kind of onboarding and using this and practicing. So is that one of the biggest challenges, or what are some other challenges you think that we are facing right now in trying to make genomics more translational?
So I have a very clear vision of how we can bridge this into clinical care, and we're putting this into practice today with health systems all around the country. So first, it's starting with patient engagement and care navigation tools. Every patient coming into a primary care setting on an annual basis should receive a risk assessment, and that can be done in a digital health manner. So it does not take time off from the clinician. It allows us to better assess and identify those patients based on family health history and other factors that would make them at an elevated risk. So it starts there, and then it's navigating towards predisposition risk screening. So we can actually get ahead of disease and then find disease earlier, with tools like multi-cancer early detection. And by doing so, that really allows us to, again, move into more proactive health, wellness, and management rather than the reactive symptomatic treatment we have today. And taking something just like cancer, if we can find cancer early and treat it early, we will not only save 70% of the cost of treating late-stage cancer, but we will also obviously dramatically improve outcomes. And that's how, in my mind, we help realize some of the goals, which may seem audacious, like our cancer moonshot, but are very attainable, We simply need to apply clinical decision support, education, and access to specialists. So at Genome Medical, we bring access to medical geneticists, genetic counselors, even oncologists and cardiologists and pharmacists, right? Individuals that are very knowledgeable about genomics so that we can be kind of a bit of a safety net for providers and better understanding how to appropriately apply genomics in clinical care.
Yeah, wow. So one more question. Tell me a little bit how Illumina's technology has kind of impacted or advanced the work that you guys are doing at Genome Medical.
For me, I've always said as the cost of sequencing declines and the clinical utility increases, there's a point at which those two lines intersect, and that is the point at which sequencing for the entire population makes sense. So we're not there yet. That is still future looking, but what I like to encourage is that doesn't mean genomics is off in the future. Like, we are stepping towards that future by trying to first determine who has clinical need today. And that's not the entire population, but there are very clear areas where clinical utility is well demonstrated. We have the data. It's actually part of standard of care and medical management guidelines. And that's where we need to most focus first.
Okay, so I want to hear a prediction. You said where these two lines intersect. We don't know. We're not here yet. Give me your prediction on when we'll get there.
I think it is the $100 genome. And honestly, at the whole population level, I don't think we'll start with whole genome sequencing. I honestly think within 5 years, we could be at a place where we are doing a broad-based, proactive panel that's looking at cancer, cardiovascular disease, and other high-risk factors, and allowing us to start to move into earlier detection and even prevention for many of the leading causes of death.
Okay. So what's the number?
5 years.
5 years.
Within 5 years, but not whole
you
genome
did say
sequencing.
5 years. Okay.
Proactive, targeted panel.
Got it.
For vast portions of the population.
Okay.
5 years.
5 years. And in 5 years, what is Genome Medical doing?
Well, we will have marched from our deep basis in genetics to more comprehensive care for genomic-based medicine in a broader way.
Okay, wow. Well, we're looking forward to it. Thank you so much for taking the time today and talking to us about the wonderful work you're doing at Genome Medical.
Thank you so much. This was a joy. Thanks.
This is great. Learned a lot.
All right.